Hello guys, here comes one more short video on how to remember the distal clavicular erosions or absence. So there are multiple causes for which we have to know, and let us remember all those causes in the form of a mnemonic called short pencil. Whenever the clavicle is shortened or the distal end is eroded or absent, it looks short, right? So in that way you can remember short pencil as scleroderma, hyperparathyroidism, osteomyelitis, rheumatoid arthritis, trauma and progeria. Let us understand them with the form of the examples. In this X-ray we can see bilaterally there is absence of the distal end of the clavicle, and when we look closely we can see that absent end or the distal end is smooth here, indicating it is rheumatoid arthritis, or it can be in scleroderma also. Then comes the second condition where there are irregular erosions in the distal end of the clavicle, and it is seen in post-traumatic osteolysis in this example. The third example is showing irregular erosions in the distal end of the clavicle as well as few subchondral cysts noted at the distal end. Here the clinical history is the clincher to the diagnosis of psoriatic arthritis. Then comes the fourth example where there are distal erosions or narrowing noted in both bilateral clavicles in the condition called hyperparathyroidism. To clinch to the diagnosis of the hyperparathyroidism, we have to look at other skeletal structures also. Like in the skull, it has thickened calvarium and salt and pepper appearance. In the hand, it has soft tissue calcifications. And at the tip of the distal phalanges of the hand, in the thumb and the little finger, there you can notice the acral osteolysis. Acral osteolysis is also one of the important feature of the hyperparathyroidism, which helps us to clinch to this diagnosis. So in the thumb also, you can see the acral osteolysis and there are vessel wall calcifications. In this X-ray, we can see subperiosteal resorption, particularly on the radial aspect of the hand. Subperiosteal resorption is also an important pathognomic feature of the hyperparathyroidism. And in the spine, you see a pattern called rugged spine in HPT. So these are all helps us to get to the diagnosis of hyperparathyroidism. So these are few important examples of distal end of clavicle erosions. If you like the content of the video, please do like, share and subscribe to the channel. Here's the QR code for the Telegram channel where I post regular updates, important topics and concepts for the exams, and few tips and tricks to master them. Thanks for watching.